Hey, Peace Nicks. Today's guest is Harrison Jordan. Sometimes on this podcast, I get off subject. I get, into things that are political, things that are not related to the drug war, or I'll have a guest on and we won't, who wants to talk about psychedelics, but we end up talking about something else entirely. We never really get to the subject. But today's guest, Harrison Jordan, he is a psychedelic and cannabis lawyer from Toronto, Canada. And today's really what this podcast is about. This is the Peace on Drugs. It doesn't get much more peace on drugs than what this conversation was about. So you're going to enjoy this one. I know I really enjoyed talking with Harrison. So let's go ahead and dive on in.
America's public enemy number one in the United States is drug abuse.
Drugs are menacing our society.
What are your thoughts on the drug problem?
I had a great time doing drugs.
So tonight, from our family to yours, from our home to yours, thank you for joining us.
This is the Peace on Drugs.
All right. Well, Harrison, thank you for joining me on the Peace on Drugs podcast.
Thanks for having me, Aaron.
Sure. Where are you at right now?
Pardon me?
Where are you right now?
Oh yeah, I'm in Toronto, Canada.
Toronto, Canada.
And there's a bit of a heat wave going on here. I don't know if it's happening where you're at, but the heat is hot, I would say.
Yeah. What's the temperature there right now?
It is about 30 degrees, but it probably feels closer to 40 degrees.
Oh yeah, I'm American. I don't even know. Let's do the
Oh,
math.
that's Celsius. Sorry.
Yeah, it's 86 Fahrenheit here. I see. That's pretty cool for right now. I'm in Florida, so we pretty much have a heat wave year round here. But it never gets like other parts of the country will get in the hundreds, and we'll still be in the 90s. But it's the humidity and it's hot.
Yeah, it's we'll see how we can tolerate it as a society as we have these warmer and warmer summers.
Yeah, and it's in our country we have a lot of problems with the fires. They're running out of water in the West, and instead of us using our engineering abilities to figure out how to get some of the water that's flooding the East pumped to the West, we just don't seem to care. We're just like,
no.
So I don't know. Yeah,
we have our fair share of the natural resources issues up in Canada as well.
Yeah, I'm actually reading a book right now, Finding the Mother Tree, I think it's called, but it's Canadian. She was a logger, and but she was more of an environmentalist. But her family were all loggers, and she was figuring out how to get the forest to grow. And it's really learning about the Canadian logging industry, a lot about that in this book. But more so, it's just a fascinating book about how the forest works, how they figured out how the trees feed one another. Like a mother tree actually feeds her young through the mycelium in the ground. It's really fascinating stuff.
That's really cool.
Yeah. So let's talk about. So you're a psychedelic and cannabis lawyer in Canada.
Yes, I am.
That is super, super cool. So explain to me exactly. I probably could take a guess as pretty much what you're doing is you're trying to help pass legislation to legalize some of these things.
Well, I assist individuals and companies that are part of the cannabis and psychedelics ecosystem in Canada. And my original focus was on cannabis. I focused a lot on setting up cannabis retail stores in Ontario, and now I've branched out into psychedelics. And it's really interesting to see the shift that's happening in Canada with respect to psychedelics access. Mm-hmm. And so that's where my focus has been on. And every day is a different day. I wake up and it's a different sort of client that's calling me. And I feel blessed to be in this industry and help promulgate something that could be a viable treatment for many people for many conditions.
That is great. Now, you yourself, were you into psychedelics before you got into this? Like, have you used them and stuff, or is it just business for you?
Well, that's a good question. I don't know how much I'm ready to say on a podcast, but I will say that I have seen the effects of psychedelics on people and how it can expand their spiritual journey, as well as trauma healing with respect to past traumas, and it's really eye-opening for me. So I would say that, although I can't answer directly your question, I will say that it's something that touches me and that I appreciate seeing happen, and I appreciate all these new documentaries that are coming out, like the one with Michael Pollan.
Yeah.
And so it's definitely something that I want to be a part of, as opposed to focusing on tobacco or alcohol. And I am branching out into those areas as well, but it doesn't feel as rejuvenating and as rewarding as being in the cannabis and psychedelics industry, when it can help so many people, and we're at the beginning of things here.
I completely agree with you. And I do think, like, when you think about drugs, like the fact that we even have the term drugs that describes alcohol and tobacco and cannabis and LSD and cocaine, like those are all completely different things. And my experience with psychedelics was, when I was young, I remember thinking we need to just lace everything with LSD and everybody would trip and then the world would be peaceful. And that's really a naive thought. I mean, but when you're young, you're like, well, I took it, and without even knowing what it was going to be like, I just thought it's another drug, and I took it and immediately had a connection with nature, a connection with life. And I think it started me on a more spiritual path. And I was raised in the church, and I never felt spirituality growing up in church. And then here I did this psychedelic, and it just happened. But it doesn't happen that way for everybody. And people that have, mental issues, bipolar, or prone to schizophrenia, they can have life-changing for the worst experiences. So that's why it needs to be careful. And let me ask you this: how much, how careful do you think the industry is trying to be to make sure it doesn't turn into something like the '60s? Because the government could immediately say, you know what, shutting it down. So you got to tread very lightly and be very careful. What are your thoughts on that?
Yeah, well, I know, at least in Canada, the primary health regulator is Health Canada, and they have a tight control on psychedelics. We had a program called the ACMPR, where patients could access medical cannabis, and that was basically a program where anyone could go to any doctor and have their have a prescription signed for access to medical cannabis. Health Canada it looks like they do not want to allow that to happen with psychedelics, and so they have a very constrained system. There's only really 3 ways you can obtain psychedelics in Canada, and they're all as for medical use and not spiritual or recreational use. Number 1, there's the Section 56 exemption process. So there's a section in the Controlled Drugs and Substances Act, which is our drug law in Canada, and it allows patients and their doctors to apply for an exemption from certain drug laws. So there have been a number of patients and their doctors who have applied for exemptions, and that means that the patient and sometimes the doctor is exempt from laws with respect to whatever substance it is. So if it's psilocybin, then it means effectively the person cannot be charged for possessing psilocybin for their own use. The second way of access is through what's called a special access program. So this is a program where generally it's similar to the right to try regime program that's available in the US, where if someone is facing a debilitating condition, and it's either an emergency or they've tried they've exhausted other reasonable options, they and their doctor can apply for a special access to the medication. That medication before recently has been limited to non-psychedelic medications, but recently Health Canada expanded it so that it applies to restricted drugs. Restricted drugs under the Food and Drugs Act include a wide range of psychedelics. And so now, at least theoretically, patients can apply through their doctor for this special access program. And Health Canada has already put together class-wide exemptions, basically saying that for doctors and psychotherapists who possess the psilocybin or MDMA, Those are the two drugs in the class exemption. If they possess that for the purpose of administering it to their patient, that is permissible. One thing that's interesting under the special access program, though, is that patients themselves cannot access, cannot possess the substance. It has to be actually administered by a doctor. So it has to be physically administered by a doctor or a nurse or psychotherapist, and it has to be administered obviously in their presence. And so the patient cannot take the substance home with them, even though we've seen that there's a lot of self-discovery that people have with psychedelics, and it's not always done in the confines of the four walls of a therapist's room, although we know that therapy can be an important part of this. So that's an interesting perspective, and an interesting quirk of the special access program. And the third way of accessing psychedelics in Canada is through clinical trials. And so there are a number of clinical trials right now that are investigating psilocybin and other restricted drugs that are psychedelics. And so through these clinical trials, patients can get access to these substances in the bounds of the clinical trial. What I find interesting is that both in clinical trials and the special access program, at least when it comes to psilocybin, patients are limited to the actual psilocybin. They cannot obtain magic mushrooms, the actual fruiting fungi.
Right.
Whereas with the Section 56 application process, you're exempt from the law when it comes to simple possession of psilocybin. So how that's obtained is when it comes to those exemptions, it doesn't frankly matter. However, when the special access program was broadened to now include these restricted drugs that are traditional psychedelic drugs, DMT, psilocybin, MDMA, Health Canada closed the door on Section 56 exemptions. They said, look, unless it's a very extraordinary circumstance, they're not going to approve Section 56 exemptions. And what's interesting is that in Canada, I don't know if this has happened in the States and the US, particularly with Oregon, but basically, at least prior to the special access program, doctors and therapists themselves were applying for Section 56 exemptions for themselves to ingest the psilocybin or the MDMA as part of a training program, so that they could be trained based on their understanding, their full understanding of what these substances are all about. Mm-hmm. And right now, there's a case that's winding its way through the court system, or at least for right now, there's a challenge on behalf of doctors challenging the fact that Health Canada has said, no, we're going to refuse Section 56 applications, particularly for doctors and therapists. And it's an interesting case because we have Section 7, which is a very important right in Canada. And it's a fundamental justice right. Section 7, I'll pull it up so that I have it correctly. Everyone has the right to life, liberty, and security of the person, and the right not to be deprived thereof, except in accordance with the principles of fundamental justice. And what that basically means, or how that's being construed in the medical context, medical cannabis context in the courts, is that patients have a Section 7 right to medical cannabis, particularly so when it's particularly evident when other medicines that have been tried are not effective for these individuals. So courts have consistently ruled that medical cannabis patients need reasonable access to medical cannabis. There will likely be a case when it comes to patients who use psilocybin, because it's one of those things where certain people say no medication work except for the psilocybin or except for MDMA or some other what is called a restricted drug. But what's fascinating here is that there's a Section 7 claim being made on behalf of doctors and therapists, saying that because everyone has the right to life, liberty, and security of the person, they should be able to experience the effects of these substances before prescribing it. It's definitely going to be a harder argument than it is showing up to court and saying, look, this is a patient that's dying that found immense relief, if they had a fear of death or if they had crippling depression. It's different. So it'll be interesting to see how that pans out. I do think that physicians should have the ability to consume these substances as part of a therapy program where they're learning the rigors of the substance and the experiences that it can cause, because they're just so unique.
Yeah, and I wonder why it's so important for government to why what are they so scared of? What would we know for a fact these psychedelic drugs, they don't have lasting effects. Psilocybin, there's no down the road effects, there's no physical effects. You can't overdose and die, maybe take an extreme amount, and it's just a 4 to 6 hour experience. And what is the government so scared of letting a physician take this substance that they're going to give to their patients? I don't understand.
Yeah, you see those classic charts online of the severity of harms of different substances. And by some respects, in some measurement, there are certainly psychedelics that those measurements would say are less harmful than even cannabis. And so, it does pique your curiosity as to why the government hasn't acted faster on this. But I think it has to do with the political pressure. In Canada, we have a right-leaning party, at least federally, called the Conservative Party. We have the Liberal Party, which is sort of occupying the middle, and they're in power. And we also have a NDP party, New Democratic Party, which is on the left. And basically, the NDP has been fighting for, or at least members of the NDP have introduced legislation that would fully remove simple possession from the Controlled Drugs and Substances Act. So possession for the purpose of trafficking or trafficking itself would still be an offense. However, simple possession would not be an offense. And the Liberal Party seems to be going right up to the line without and doing everything but removing simple possession. So, for example, cities across Canada have applied to Health Canada for city-by-city exemptions that would exempt everyone in the city from the simple possession laws. And as you probably heard recently, Vancouver obtained an exemption for a small amount of certain substances that could be possessed by individuals starting soon without garnering a criminal charge. The same thing is happening in cities all across Canada and the largest cities as well. On top of that, I believe in the last year or so, the guidebook for prosecutors has basically been modified to direct the prosecutors not to prosecute individuals for simple possession unless there's really an aggravating factor. It involved a youth, right, or the possession was on a school property, some other aggravating factor. And then on top of that, the Liberals themselves have introduced legislation that would basically enshrine the requirement for prosecutors to consider measures other than criminal charges, except when aggravated factors are present. So with all those things and all those efforts that the Liberal Party is making, Occam's razor would suggest, why don't they just go with the NDP plan, which says we'll just remove simple possession from the CDSA for all substances. Mm-hmm. I think the government, the Liberal government, understands that there's a certain problem with certain drugs that are causing overdoses and deaths. and that's the opioids and crack, heroin that's laced with fentanyl.
Yeah.
And so there's lots of fentanyl going around.
But that's all because of prohibition, though. If they would legalize
It is.
give a safe supply, to even supplying heroin to heroin addicts would save so many lives.
100%. I mean, you watch documentaries of how they're doing it in some European countries, and it really boggles the mind. We know that safe injection sites help people. Even if you take a very simplistic, conceited viewpoint of, I don't want to be, I don't want to let drug users continue using drugs. Well, you're actually helping ensure the safe injection sites are helping ensure that healthcare costs are going down. For example, when it comes to HIV, because that can be a big burden on the healthcare system. And so it's, I'm proud to live in Canada where we've pushed these advances. But on the other hand, the US and certain states has pushed forth, especially in Oregon, when it comes to the psychedelics. And, hopefully that'll help push us in the right direction here in Canada.
Yeah, and Oregon decriminalized all drugs, and that's basically what you're talking about. If you remove simple possession, it's basically decriminalizing is what you're talking about, right? It's where you can have a personal amount of drugs on you, not be arrested, but it's still not legal to buy. You can't go to a store and get any of these drugs, but you just, and that makes sense to me, like on a fundamental level. Nobody should be arrested for a personal amount. We have the NBA star, Brittany. What's her name? Brittany Griner or whatever.
Griner, yeah.
Yeah, she's locked up for simple possession, and it's so tragic. And people are saying that Biden should do something about it. But my thing is well, her home state, Texas, has 160 something people serving life sentences for simple possession. So you can't sit there and say, well, Russia needs to get this fixed when we haven't even fixed it ourselves. We have people in prison serving life sentences for cannabis possession. Like we need to,
Yeah, I think it's. I think Joe Biden has really been. Really not the best when it comes to cannabis policy, because you don't really know where he stands. I mean, he's released these statements saying no one should go to jail for cannabis use. Well, duh. I mean, who's saying otherwise? Right. And he put out statements in the past saying he supports expungements but doesn't support legalization, which kind of seems backwards to me. I mean, expungements of past criminal records could be seen as a more progressive issue than legalizing it going forward. So he has this really interesting take on cannabis, and he hasn't pushed for it.
His vice president said in the debate, she said that they were going to remove cannabis from the schedule, and they were going to expunge records, and that's the last you heard about it. They just And of course, they can always say, well, we were busy with other stuff. You can say that all you want, but the reality is you could do something about this. And then the question is, well, what's motivating you not to do that? And there is a huge problem in our country with law enforcement and prison, the industrial prison complex that needs prisoners. They need prisoners. They need people to arrest. All these jobs and careers depend on arresting people for cannabis because there's not enough violent criminals for these careers to happen. So, and I just wonder, it's a scary thought that we actually need to be locking people in cages for financial purposes.
Yeah. And, if I'm not going to be here to defend a fentanyl trafficker, but if you're found possessing fentanyl of any amount for the purpose of trafficking, you're likely going to go to jail for a while in Canada. And so we're not that different in terms of locking people up for drug offenses. And I want to come back to this issue of removing simple possession from the Controlled Drugs and Substances Act. I think that the federal Liberal Party thinks that there'll be some sort of blowback, that there'll be ads that the Conservatives launch. I mean, the NDP's to the left of them. So the NDP says, let's be as progressive as possible. Whereas the Conservative Party, the Liberals will use it as a wedge issue and say, look at this. They have nothing better to do. So they're liberalizing access to drugs. And in fact, we did have those sorts of ads a number of years ago when when Stephen Harper was leader of the Conservative Party. But my thinking on this is the offense of trafficking and possession for the purpose of trafficking would still exist, for better or for worse. Obviously, we can agree, disagree about whether it's enough to just remove it for simple possession, but we know that we can all agree that it's a start. And when it comes to trafficking, there's something called indicia of trafficking. Those are the clues of trafficking. That could include someone possessing tons of empty dime bags. It could be a pill press. It could be a debt list. It could be it could be weights that are typically used to weigh substances. So these indicia would still appear in these cases if we just decriminalize simple possession. Like the people that are trafficking or possessing for the purpose of trafficking, we're still going to be able to see that. We're still going to be able to see this indicia. I mean, is it going to make prosecutors and police's job a bit harder? Certainly, but there's almost always indicia of trafficking when someone is arrested for trafficking or possession for the purpose of trafficking. If they're not caught in the act, then they're caught possessing the substance for the purpose of trafficking, and there is indicia right there. So it's tough to see that the Liberal Party doesn't want to go that far, especially when they've introduced all these measures, these half measures that are better than nothing. But Occam's razor, they just can't accept the NDP proposal to remove simple possession from the CDSA. And the last thing I want to say about that is you touched upon safe supply, which is very important. The NDP bill introduces the concept of at least exploring safe supply. So it says that the government needs to start exploring options for safe supply. It doesn't mandate any specific system for safe supply, but we know for opioids and the other drugs I mentioned, it would sure save a hell of a lot of lives.
It definitely would. And I know Canada is a little bit better than the US at safe supply. I mean, they have a little bit more programs. I believe it's hydromorphone that they're prescribing, but it's hard to get in the program. It's very restricted, but we have none of that here. But the people that are in this program, it's Demerol, I think is the brand name. And the people that are getting Demerol, which is, I still think heroin might be better, but Demerol works way better than methadone. The people are able to get their drugs, and people that have safe supply of whether it's heroin or Demerol, they're able to live very productive and happy, healthy lives. The reason the heroin addict, it looks like it's such a horrible existence is because on the streets, when you're buying your drugs in the streets, you're paying an extreme amount of money for something you don't know what you're getting. You could get fentanyl, you could die. Where are you getting your needles from? There's all these other questions around it. And so when people think that if we legalize heroin, everyone's going to look like the homeless people are on heroin. No, actually we'll have less homeless people. And if you think about what happened in Baltimore, during COVID, they stopped arresting. It was supposed to be temporary. We'll stop arresting for simple possession and even simple drug dealing. If it's small time, we're not going to arrest for it because we don't want to have people in jails because of COVID. So they stopped arresting. They thought crime was going to go up. Crime went down. And so after COVID was done, they said, well, we're not, the DA in Baltimore said, you know what, I'm going to keep this policy going. We're done arresting people for drugs, for small time drug offenses. And that's because when you look at the actual data, and I guess this is the problem we're talking about though, politically, data doesn't matter. If you're a liberal party and you legalize or decriminalize drugs, then the conservatives, they just run ads that say, look at this person, they're trying to get all your kids hooked on drugs. And then it freaks out the conservatives, and no one's actually going to listen to the facts when you say, actually, it's more dangerous for your children to live in a world of prohibition. They risk arrest, they risk dying from a adulterated product with fentanyl. There's all these risks for your children that make it worse. But when I wrote my senator, Marco Rubio, he responded with, it's always about the children. We can't legalize cannabis because it gives the wrong message to the children. It's like, all right, well, for one, I don't have children. And two, why should I risk, because you have children, I have to risk getting arrested for choosing cannabis? Right. And it's like, this is absolutely stupid. Also, when your children come of age, because I lived in an age when when there was no legal cannabis at all in the 90s, and I was able to buy it anytime I wanted it. There was other drugs offered to me by the drug dealers because they were selling whatever they could. So I was offered Xanax and pain pills and everything else. And who knows what drugs I was getting, what the cannabis I was getting that was coming from Mexico, who knows what chemicals were sprayed on it, pesticides. It was all adulterated stuff. And I got arrested and I have a permanent criminal record to stop me from employment. So you can't tell me that the prohibition has been good for me. And it has, and it's not going to be good for children now. It's not good. We have to open our eyes to this and realize that it's really messed up the way what we're doing.
Yeah, I'm with you on that, and it's for better or worse, we're doing some things in Canada right, and there are some states down in the States that are doing some things right. But I think generally we're moving in the right direction. I don't think we're moving backwards. It might take the next president, and I was going to say Democratic president, but it could be a Republican, especially if it's someone that has libertarian leanings. So whoever the next president is might be able to produce more efforts to usher it in, rather than what we're seeing with Biden now.
I agree. And the problem is, like, so I'd love to see a libertarian actually win, but that's not really possible. But also, I'm not really a libertarian. Libertarians do support privatized prisons and stuff like that. But the problem is the Democratic Party, where my views would mostly lie, I feel like they're corrupted. They're not who they say they are. If you look at Clinton's policies, they were way more conservative than any Democrat should have been. They were horrible for the poor working class people. So I don't think that the DNC really stands up for the people like they should. So therefore, I'd happy vote for a libertarian. And like you said, it could be a Republican. And I have no problem voting for a Republican if I like what they stand for, even though most of their conservative issues, the problem I have is their Christian moralities that they seem to want to push on everybody. And that's what we're seeing right now with our Supreme Court. They just reversed Roe versus Wade. Now they might be going after gay marriage. And I mean, it bothers me to the core that, because me and my family, they're very religious, and they're anti-gay marriage. And the thing is, but they're not gay. And it's like, so what do you care? How does this affect you at all? And they will be happy if it gets overturned. But I'm like, could you imagine if your marriage was at risk of not being anymore? You're just not married anymore because of a law? Like, that's fucked up. Yeah. And so that's why I have a problem with the Republican Party. But that does not to say, like you said, if a more libertarian leaning Republican came in who wasn't against the gay marriage and abortion, which, by the way, Donald Trump, I don't think gives a shit. He has no problem with gay marriage. I don't think he has a problem with abortions. He's just leaning into his base. They love him, so he's going to do whatever, and he's going to put whoever in power who is going to make these changes, and that's what happened. So yeah, it's a very interesting system, and we'll leave it for another day. But I think lobbying probably has something to do with it, and the amount of lobbying and related activities that are permitted, and super PACs, and so that's a discussion for another time. But it's hopefully we're moving in the right direction when it comes to allowing people to be themselves and do what they're doing, as long as it's not harming others. I actually stopped consuming cannabis, and you'd think, wouldn't it be easier to stop? Aren't you most likely to stop consuming it when it's illegal, when it's out of sight, out of mind? But I think normalization, in a sense, brings it out. It brings out honest conversations that we can have, and I think it allows for reflection that, look, just because it's legal doesn't mean it's going to be particularly good for me. Alcohol is legal, and if you drink it all day, every day, you're going to have negative effects. And I don't want to compare cannabis to that, but I think that I think it's no coincidence that we're seeing in certain jurisdictions that decriminalize or legalize these substances, that use rates go down. It becomes less of a forbidden fruit for youth, and it becomes something that people can talk more openly about. Yeah, you're right. And the forbidden fruit thing it's very powerful in our minds, because if you think about a drug, it's like a bad thing. It's on the streets. There's a whole culture around it. If you thought about it just like a drug, like the pharmacy, like you went to the store and you got your heroin, and that's what we saw happen in Switzerland. Switzerland has a huge rate of people getting off of heroin.
Mm.
Not everybody will. Some people will be on it for the rest of their lives, but a majority of them, once they get their lives together and their lives aren't falling apart, then they're like, all right, well, now that this is together, let me stop having to go to this clinic and let me slowly wean off of the heroin. And when because that's the thing, if somebody's life is destroyed and they're on the streets using drugs, it's hard to get sober when you're in that place. So
Yeah.
I think that's the whole thing. But I am excited about the legal, or as we're seeing the tides turn on psychedelics, because I mean, psychedelics shouldn't be much of an argument for not having legal access. You can do it safe way. It doesn't have to be like, all right, here's a bunch of hits of LSD, go to the concert with, even though I would like it to be that way. But no, are you guys? Do you have ketamine clinics up there? Are they doing that too?
We do have ketamine clinics. So yeah, ketamine in Canada is regulated as a controlled drug. So it is not considered a restricted drug. And basically, because it's been used as an anesthetic in the past, it's now being used as a for treatment of depression and anxiety and those sorts of things. So it's being used off label, you could say. And I believe the situation is similar in the US.
Yeah.
I don't think we have certainly the breadth of ketamine clinics and the sheer number of them that are in the United States. And I think a lot of the ones in Canada, at least, they use sublingual lozenges as opposed to intravenous. But we definitely have them in Canada, and it's definitely something that's helped people. Yeah.
Yeah, I've heard they've helped people here too. I was debating on trying it myself, but it's like $4,000. Insurance won't pay for any of it, so I decided it was too expensive. But and I hate that, because some people that could really benefit from it, there's no way they could afford $4,000, especially people that's lives are messed up because of their depression. And so it's like a catch-22. If I could get better, I could make the money to afford the treatment. But hopefully we'll
absolutely see. And I'm sure if you look at it long term, it's there are less costs to the healthcare system by getting people the treatment that they deserve, and that can make a lasting impact.
Yeah, I know. And that's we have a huge problem with our healthcare here, and the debate's never ending. Our country spends more money. Our government spends more money on healthcare than most countries, and we don't even have socialized medicine. And now I don't know how it's going to affect, but Amazon's making a dip into the world of health insurance. So, and I could see them monopolizing it. They're kind of taking over everything. So I don't know.
Well, they're also in favor of legalizing cannabis. So hopefully if they do take over healthcare, they'll integrate some cannabis into it.
That'd be great. And then if I could just order my cannabis on the Amazon app.
Oh, yeah. Yeah, wouldn't that be something?
It would, except for it would put out a lot of the small businesses. That's the problem I have. And then you see Amazon advertising like, I'm a small business owner and I sell on Amazon and it helped my business. So they're trying to appeal to people like me who have a problem with them destroying small business. It's like, I don't know. What are you going to do though? You're not going to stop a beast like that. Once you've created this monster, it's going to keep going. So hopefully. Yeah.
And particularly with the pandemic, there's been a lot of online ordering on Amazon up here in Canada. It's really taken hold.
Oh yeah.
But I do think that if Amazon Prime was expanded to cover delivery for cannabis, there would be a lot more people who subscribe to Amazon Prime.
I would be one of them. I'm not a subscriber, but I would. But yeah. So it was great talking to you. I won't keep much longer. I just wanted to say, is there anything else you wanted to talk about before we wrap it up?
Well, I just like to say that it was great chatting with you, and hopefully I've imparted a bit about the Canadian experience when it comes to regulation of psychedelics. And we're a friendly country, so everyone come on up to Canada. I'm not saying you're going to get access to psychedelics here. We're not there yet, but it's I feel blessed to live in this country. Not everywhere. Every place has their skeletons in the closet, and we're not there yet when it comes to safe supply. But I wake up every day feeling grateful to live in this country and not have to go face prison for years upon years like Brittany Griner if I were to happen to possess cannabis, right?
Mm-hmm.
So I really do appreciate my time with you, Aaron. It's been great.
Yeah, thank you so much for joining me on the podcast. It was really great talking with you. And I tell you what, I'll reach out if I ever do come up to Toronto, because that's definitely a city I want to come visit.
Sure. Please do. Yeah.
All right. Well, it was great talking to you and great meeting you.
Take care.
All right. Peace out. All right. Peace, Nicks. Hope you enjoyed that one. If you are enjoying what we're doing, go to Apple Podcasts, give us a 5-star rating. Make sure you follow us on Instagram and Twitter at the Peace on Drugs Podcast. And go to www.thepeaceondrugs.com/subscribe to subscribe to our newsletter. Here's Twiggy Branches. Peace out.
What you get, you pay for what you get. You pay for what you get when you align yourself with the phobia jet set. Bad head, bad high, moves hard, pocket in mind. So I'm sending love east to cocaine and smile. Watching the sunrise, watching it all, Sunset Boulevard. Are you my doctor? Are you my dealer? Are you my? You pay for what you get. You pay for what you get. You pay for what you get when you align yourself with the phobia jet set. Bad head, bad high, moves hard, why can't it mind? So there, second in a breeze, and by the grace of God, I see the sunrise. I see the sunrise. Are you my doctor? Are you my dealer? Are you my doctor? Are you my dealer? Are you my doctor? Are you my dealer? Are you my doctor? Are you my doctor? Pay for what you get. You pay for what you get. You pay for what you get. You pay for what you get. Are you my doctor? Are you my dealer? Are you my doctor? Are you my dealer? Are you my doctor? Are you my dealer?